So let me kick it off, although we've sort of informally already started. I'm Michael Goldberg. Good to meet Vineet earlier today back on campus, and Jasmine, welcome back. It's great to have you. Welcome to our Founder Friday speaker series. This is something we've been doing for about the past 5 years in sort of various forms. Always great to welcome folks back to campus, you Vineet, and we have students that moderate. So Amos Langsner, who's been incredibly involved with a lot of our different entrepreneurial activity, particularly wearing the investor lens. So Amos has been a leader on a couple of our campus things, including the Alumni Venture Fund. We just made our 15th investment. Go Amos. And Amos will moderate the discussion. We'll sort of kick it off. If you're on Zoom, just sort of let us know with your Zoom hand that you want to jump in. Britton will be sort of monitoring the Zoom. If you're on LinkedIn and watching, put a question in the comment and we'll go and feed that to Amos as well. And then obviously for the folks here in the room, this will be conversational, so join in. So with that, Amos, I'll turn it over to you.
Real quick, should I unmute on this?
No, do not mute. No, you're on that. Don't touch anything.
Awesome. So thank you everyone for coming. Like Michael said, I'm Amos. I'm a senior at Case. I graduate the fall, studying mechanical engineering and entrepreneurial studies, and I'm a fellow at Case's Alumni Venture Fund. And I'm also an incoming manufacturing engineering intern at Lincoln Electric. I've been involved with the entrepreneurship, venture capital stuff at Case for a while. So first off, I wanted to say a big thank you to Vineet for coming today. We really appreciate it, and I'm really excited to hear more about your story and your company and everything like that. So I'm going to start off the session by asking a few questions, and then about halfway through, we'll turn it over to the audience, like Michael said, LinkedIn, Zoom, in person for more questions. So real quick, I wanted to give Vineet a quick intro. So I had the pleasure of talking with him a few weeks ago, and so he's the COO and co-founder of the medical device startup Genetesis. Really cool company. He grew up in Cincinnati, studied BME and EE at Case before pursuing Genesis full-time. And their flagship product, CardioFlux, uses magnetocardiography, or MCG, to non-invasively monitor the electrical signals and the magnetic field given off by a patient's heart to quickly and non-invasively screen for a variety of heart conditions. So yeah, with that, I wanted to start off real quick. I was wondering if you could tell the audience a little bit more about Genetesis as a company, what you guys do, and what was your inspiration for founding it?
Yeah, absolutely. So first of all, thank you for having me. It's wonderful to be here. Genetesis is a medical technology company, like you kind of mentioned. We're located in Cincinnati, Ohio. We have about 30 people who work for us right now. And we've been in business and full-time working on this since 2016. Since that time, we've raised about $40 million in capital so far. Most of it is going towards both building the product and then validating this clinically as well. With our next chapter now being this early commercial chapter where we are finally turning the page and now commercializing technology and selling it to clinics, as well as offering it now as a consumer solution as well that I'll get into a little bit later. So the product, like you mentioned, called CardioFlux, is a magnetocardiograph. It operates by looking at the electrical circuitry that the heart naturally has, that it uses to regulate all of this pacemaker and that function to actually beat and pump up throughout the body. But aside for a second, the heart itself is a very resilient organ. It tends to be that once you have some things that start to go wrong in the heart, whether it be in the heart, in the vessels, or other parts of the heart as well, it's good at compensating for those types of things that happen, right? And so what ends up happening is that the existing technologies that are there today that look mostly at the structural phenomena in the heart, including things like narrowing of the blood vessels and that kind of a thing, tend to miss the earlier signs of disease and tend to not be effective until it's a little bit too late, right? Where you can't really reverse the disease at that point in time. Or in some cases, the disease is actually not even structural in nature, it's more physiological in nature. So our big push was to try to find ways to look at that electrical circuitry as a earlier means to identify the disease, because the first parts of the cascades related to disease before it becomes enough of a problem where you're going to have severe symptoms and maybe have to go to the hospital and that kind of a thing tend to be in small changes in that electrical circuitry. And that is really what MCG, magnetocardiography, is good at picking up. So our product, CardioFlux, like you mentioned, right, looks at the natural magnetic emissions of the heart. And that information is significantly more information rich and significantly more lossless than other modalities that look at that electrophysiology, such as like EKG, for example, right? And really you get similar levels of information as things that are very invasive if you're using the right kinds of signal processing and right kinds of mapping techniques as well. So our device, essentially called CardioFlux, is a large piece of imaging equipment, right? It's something that you basically are lying on a table for. You're positioning an array of highly sensitive magnetometers or magnetic field sensors over the chest, and they detect the weak emissions from your heart that are millions of times smaller than its magnetic field. So we have to really like find a needle in the haystack to be able to identify a lot of the things we're looking for. But that basically is the product itself and what we've been able to do. And you can access that product in two ways. We've been able to develop software platforms around that product that allow for you to diagnose disease very precisely. So from the point of view of if you're a doctor who has a patient who is suspected of having a variety of different types of diseases, but mostly on the ischemic heart disease cascade, it's helpful in identifying large vessel disease, but also types of disorders that right now there is no non-invasive way to solve for. Things like microvascular dysfunction, for example, that really don't have good analogs today that you can actually use and look at fully non-invasively. So our technology basically was really driven by that main core piece originally, but through our own assessment, right, what we've been able to find is that there's a lot of biomarkers you can pick up from that signal that are also useful in long-term disease stratification. So you could find someone who is at risk of having disease before the actual true, like, irreversible symptoms actually occur. So we'll talk more about it later, I'm sure, in this part of it, but you also asked the question about how to get started. Yeah. So after my co-founders and I, we all grew up near Cincinnati in a town called Mason. We went to college separately. They both went to Ohio State. I was here in Case Western. We all had various experience in like biomedical research labs, right? So we had done like intern work, grunt work, lab work, really, right? Primarily in cardiology, right? So there we got our taste of how the heart functions, how it works, and why these electrical phenomena are the initial signs of disease. And we were all intrigued by the fact that you had this very precise way to look at diseases and disorders in the lab when things are on a petri dish in front of you, right? But there really was no good analog for looking at that then at a whole body level, right? In a non-invasive kind of capacity. So our mission, and it was sort of underscored by some tragedy in our CEO Piyush's personal life, where his grandfather began to have a series of cardiovascular conditions where he was bounced back and forth between hospitals, in surgeries, various diagnostic tests for years and years. And we very quickly then sort of figured out, we identified the gap at least, right? That it doesn't make a lot of sense. We can see these deep insights in the lab, but we couldn't really see it at the surface level. So that became our push to try to see what we could do to actually build that technology. So we founded the company, and while I was in college, I was working part-time on that business, right? And eventually we stumbled upon this sort of forgotten technology called magnetocardiography that we thought could do the trick because it had this very, very rich information like I was talking about that electrophysiology, and it could be done non-invasively. It was developed in the 60s and 70s, but it was totally forgotten about, mainly because it was too complex at the time. It required too much infrastructure and a lot of like hand calculations and this kind of a thing. But we very clearly saw that with parallel fields where they had advances in sensor technology, and obviously, generally speaking, the world of computers gotten way better since the 60s and 70s. There was like absolutely a way we could dust that off, bring it into the 21st century and deliver it in a package that was much more amenable to the clinical workflow. And that became our push to build that software solution. And we got far enough along that we were able to close our initial seed round with funding from CTech and Mark Cuban. That was really the big push for us to be able to leave school and do it full time.
Awesome, that's great. And so right now you're in the COO role at
Yes.
Genetesis, right?
Yeah.
What do you most enjoy about your current role?
I'd probably say it's the range that I get to enjoy, right? So in the very early days, in any kind of startup company, you're kind of all product and market focused, right? You're trying to build a solution that will work for the market that you've chosen. So then I got to use my engineering brain to do the actual hard work of developing and building a medical device. And a lot of it though, as I kind of then grew into the COO role, kind of evolved. Now, I think there's a couple different archetypes of a COO that you can kind of consider, right? There's one of which is the external COO, where you're doing more on the business end of things, trying to pitch the company, get money, that kind of a thing. But I've taken more of the internal COO role, where my responsibilities tend to be on the highly technical and like constrained problems and unconstrained problems, both the organization. That takes up probably like 80% of my time, right? So in my current role, I'm in charge of things like engineering, software, hardware development, things like quality, regulatory, things like even like general HR and administrative functions as well, which has been cool for me because I've been able to like have a lot of diverse experiences in different kinds of areas. But I also get to be involved at the higher level business end of things as well, right? So communicating the company's mission and vision as well. And for example, earlier this week, I was in New York at the New York Stock Exchange, like basically talking to investment bankers and this kind of a thing about potential future growth plans for us. But I like being able to do that, as well as in the same week, look at a new sensor technology and what the roadmap looks like for validating that in our internal product. So I really like that sort of range that's associated with the role.
Definitely. Yeah, that sounds great. Good variety of a bunch of different
Exactly.
stuff to work on.
Yeah.
Awesome. And what's been the biggest challenge that you faced in building Genetesis so far, whether it be, on the technical side or on the business side or something else?
Yeah. So if you asked me this like 5 years ago, I'd probably say it was much more on the technical side. It was hard to get the product right in the early days. But the bigger problem, I think, with any kind of med tech company, especially like ours, which is more of a category definer because there doesn't exist the solution already in the workflow, is the headwinds associated with medical adoption.
Yeah.
So especially for this, right? It's not like a Me Too product where we're saying we have a better surgical stapler or something like that, where it's easy to think about how it fits into the workflow.
Yep.
This is something where for us, we've had to be really creative about how we implement a technology that will work for the market, yes, but then also like how do you run the right kinds of clinical validations and studies to prove to people that this has value?
Mhm.
And then how do you also build the infrastructure around it to like enable this as a research tool, for example, so that people can take their own use cases with it and run with it?
Yep.
Because MCG is a platform, something that we're really committed to is
Mhm.
making this a platform like MRI or CT,
Yeah.
where this can be something where it's a technology that you can basically use on a whole variety of different disease states, right? And building and driving towards that end mission has been a big challenge because there's things like reimbursement.
Yep.
FDA, for example, we don't get regulated as a typical like 510Ks is a trade, sort of a name for that kind of an approval where it's a pretty straightforward thing.
Mhm.
We have a different level of scrutiny because it's a technology that's never really been seen before, or at least used regularly clinically.
Yep.
That's really been like, I think the biggest challenge we've been facing recently is how do you convince people that this is something they need to be able to use?
Definitely. And actually just adding on to that real quick, obviously you've had a decent amount of success with that. You've gotten a couple of units installed and,
Yeah.
some adoption. What has been like the biggest breakthrough in tackling that challenge, if you could think of anything?
Yeah, I would probably categorize it in two different ways. Number one, it is finding ways to empower our investigators, right?
Mhm.
So we have built a core platform that has a lot of really interesting data insights that you can get, a lot of interesting biomarkers like I was talking about that you can look at in the signal itself. But then allowing the sites we've installed these devices at, the investigators there to have a sandbox to play with,
Yep.
to think about what are new ways you can use this, what are new use cases that we haven't thought about. So beyond the world of ischemic heart disease, which has been our primary market that we've been focused on, things like more orphan disease states, cardiomyopathy, transplant rejection, these kinds of things. Our partners, for example, we're even here at the Cleveland Clinic, right, have all had a big hand in helping us think through what are those additional use cases that
Yep.
they themselves want to investigate.
Yeah.
So that this ends up becoming a more accepted tool broadly. The
Yep.
more use cases you can have for it, the more sort of wide your funnel is in different
Yeah.
disease cases. It's easier to justify, a device that costs several $100,000. You know what I mean?
Exactly, 100%. So if I'm understanding correctly, kind of like, I don't know, if you look at like blood pressure or something like that, where you read someone's blood pressure and it can be a marker of a bunch of different diseases, you make MCG, I guess, kind of that, and you allow your investigators to figure out for themselves what specific signal
Correct.
interpretations are a marker of.
Exactly. It's a little bit more broad than just blood pressure because the information you get is more than just a single take-home number.
Yeah.
But yes, agreed in principle, right? The idea there is that you can use the images that you generate that show, again, the full electrical activation and deactivation of the heart as a way to, you're looking at different signals in that information to be able to say, yep, this is indicative of microvascular dysfunction, or this is indicative of, coronary artery disease, or whatever it might
Yep.
be, right? So we developed some use cases for it,
Mm.
but there's more. And the other comment I'll also make on top of that is that we've also been able to really like take a look at a deeper dive in the data and from there, we've been able to also introduce more of like a consumer angle to this, right?
Yep.
Because there's this entire concept of like, you could wait until you become a patient, but if there's a way to access this earlier, understand your individual risk, there's a lot more you can do to potentially prevent it from ever becoming a true disease state.
100%. Awesome.
Yeah.
And then what's the biggest challenge that you expect to face in the next 10 years going
Yeah.
forward?
I would say it's gonna be this, I don't wanna echo myself here, but it's gonna be this challenge of like, you have a device, it's capable of working, right? But the adoption risk is gonna be the biggest thing.
Gotcha.
So we're at the point now where we've de-risked the technical piece of it. We've shown there's good clinical validity to it,
Mhm.
but there's a lot of great technologies out there
Yeah.
that work, but if they cannot make money and drive adoption, it's not really a business, right?
Yeah.
And so that's really our challenge right now is finding ways to convince people that it's worth the potential risks that they're gonna face with things like healthcare reimbursement, for example, right? And a lot of it for us has really become finding these like newer niche disease states that there really is no good alternative for, because there's a clear argument to be made where you can't do it otherwise, or it's miles cheaper to do it this way than having to be invasive about it, right? So that's really been our push. And then the second piece of it too that just from an adoption standpoint as well, is that being able to also present this in a way that you don't have to be gated by a physician to be able to access it.
Yeah.
Is a big piece of this, right? So in this new wave of preventative medicine, that we're kind of seeing people wanting to take the control of how they get their medical treatment into their own hands. We've seen a lot of success with the consumer angle, where somebody can sign up on their own for a non-diagnostic test, come to one of our centers to actually get a scan and get a wealth of information from that about their own individual cardiac profile has been, I think, a great way for us to also show the world the utility of the device as opposed to just telling them that and hoping they'll adopt it.
Yep. 100%, I completely agree. Yeah, as soon as you guys get one in Cleveland, I'll be stopping by.
Yeah.
I'm definitely big into like the
The
testing.
preventative stuff, yeah.
Yep, and we've seen all this, the rise in like the wellness spas or whatever,
Yeah.
offering, different like vitamins and therapies and all this type of
Yeah.
stuff. So I agree. I think it's a great angle to take,
Mhm.
kind of parallel revenue stream.
Yeah.
Moving forward, what are you most proud of about your company right now?
It is that exact thing. So before a year ago, right, our thought was we were only a medical device company, right? All we could really do was build a product that would eventually be sold to hospitals, be referred by physicians only, and diagnose disease. A very noble mission, still something that's very important to be able to do. But about a year ago, I'm proud that we were basically able to, I think, still retain the nimbleness after almost 10 years of being in business, right?
Yeah.
To still try new things.
Yeah.
So we just had the idea. We look at this information about it led to these 1,000+ patients we've scanned in clinical studies and see if there's any prognostic value to this to be able to say, if you're a healthy patient, can we predict your disease risk?
Yeah.
And through relatively rudimentary, like machine learning type of tools and that kind of thing, we put together a pretty robust scoring system called CardioFlux Score, basically, that has 14 different biomarkers that we basically use to be able to proactively predict somebody's disease risk.
Yep.
So whether you're interested in running a marathon one day or optimizing your marathon time, or you're interested in like living a disease-free lifestyle, right? This solution basically helps you understand where you're tracking relative to people in your age group and what things you can do, because I mentioned before, the heart is a resilient muscle. It is malleable. So a lot of the existing diagnostic technologies that you have access to only once you're a patient are only going to give you a snapshot in time where, well, it's this bad, but it only could get worse from here. Unlike those technologies, our technology is able to very easily say, yes, this is where it is, but these are the genetic baseline elements that you might have, but this is the room for improvement that you have in your biomarkers right now that, if you're interested in doing it, this is what you can do to improve them. So again, accessing this is like a brand new way to see this technology is really what I'm proud of, and staying nimble in the path of being able to get there.
Awesome. Yeah, 100%. And what are you most proud about of yourself, in ways that you've grown? I imagine you've grown quite a bit since pursuing this full time.
Yeah.
What are you most proud about yourself in that?
I'd argue this wasn't something that I was always like able to do quickly, right? But I think it's about not letting like the piece of paper or the exact educational experience stop me. Especially in the early days, right? I think it's really easy to think, okay, I don't know this world of medicine very well, right? But you kind of have to learn, and I'm proud that I've learned to become comfortable with becoming uncomfortable, right? Putting myself out there and saying, even if I look like an idiot in the moment, I'm gonna ask the dumb questions, I'm gonna figure out like what this actually means so that we can improve what we're offering here. So that's really been, I think, the thing I'm most proud of is like learning how to be humble in the right moments, right? And know what I don't know, but also like be uncomfortable and try the new things,
Yeah. Definitely, 100%. So when we spoke, you mentioned that your long-term goal with CardioFlux is to minimize it, make it cheaper, make it more accessible. What does like the R&D and product development process look like for that? Because, for those who aren't familiar with CardioFlux, it's basically the size of an MRI.
It's big, yeah.
And, MRIs, correct me if I'm wrong, have been the same size for quite a few years.
Yeah.
So I was wondering, what's the process like to shrink this?
Yeah, so the cool thing about it is that we are obviously different in MRI in the sense that the only thing that actually does the work on the device are these magnetic sensors, right? So you're talking about a sensor-driven measurement, right? The only reason you need all the size associated with the unit itself is because of the level of noise rejection you need to be able to do. So when we got started in 2016, right, there were not a lot of modern solutions for magnetic sensing out there at that kind of a low field level. So for us, we were kind of limited in what the form factor could look like. The advantage of technology and the pace of innovation over the past 8-9 years, right, has really made it such that there have been evolving tools out there from a sensor side of things that are better inherently at dealing with noise rejection. And then there's the second element of it that our R&D roadmap really is going to focus on, which is, there have been competitors of ours that have tried to release like totally unshielded solutions that operate in open air that you can make much smaller, right, like a cart size kind of a thing. But they've always been plagued by this problem of magnetic noise. So when you have fields that are coming off the body that are picotesla levels, that's 1 times 10 to the negative 12, right?
Yep.
Everything around you, right, will give off a magnetic field that's ferrous in nature. You will basically have like things like cars that go by, things like electronics that are around, that will basically prevent you from being able to get a clean signal because they're just going to cause so much interference in the same bandwidth of interest as the hard signal.
Yep.
So a lot of the newer techniques that we've begun to engineer internally that we will think are really going to be the foundation of the next generation of this thing are more advanced signal processing techniques that use things like Bayesian factor analysis, what's called like independent and principal component analysis to be able to pick out the signal from the noise.
Yeah.
And that's really going to be like paramount in being able to do this, right? So it's this combination of new sensors and further advancing compute, right, that will allow us to shed the old form factor
Yep.
and really focus on the sensor element as being the main like innovation technology. Because the rest of it is kind of a shell that enables sensors to work, but
Yeah.
it doesn't have to be a forever problem, right?
Exactly.
Yeah.
And so you can turn that giant shielding shell into just code, basically.
Precisely. That's exactly the way to put it. Yep.
Awesome. If you could go back to your freshman year at Case and restart your career with all the knowledge that you have now, what is the one biggest thing that you would do differently?
I tell myself to keep it simple, stupid.
Yeah.
Like in the sense that like when we first started, right, we were so obsessed with building like the right product. It was so easy to let grade get in the way of good.
Yep.
So like obviously anybody will say this in hindsight, right? I probably could have shaved a couple years off my entire journey if I had known this thing, right? And for us, I think it really was about like getting a product to a minimally viable enough point where we could get feedback and understand what the real gating items were.
Yep.
So that we can get to a point like where we are right now, a couple of years previously.
Yep.
And I think that also exists on a couple of different paradigms, right? Not only the actual physical product itself, right, but understanding what the market's going to be and the FDA pathway and everything like that.
Mhm.
If we were less, I think, like a little bit like assuming that our device we treat like every device before us, right?
Yep.
And treat this more as like a let's just fail fast and get to an answer kind of a thing.
Yeah.
It would have done a lot to, I think, have made us more efficient, yes, but also made us knowledgeable earlier on in the process so that,
Yeah.
you know, all of the wealth of knowledge I feel like I mainly accumulated in my late career, the last, 5-6 years or whatever. Ideally, I could have been at this point earlier on.
Mhm.
So that's probably what I would say.
Gotcha. With the exception of MCG,
Yeah.
what do you think will be the most important or disruptive technology in the medical device space over the next 10 years?
Yeah. Probably top of mind for a lot of people right now is artificial intelligence,
Mhm.
but I'm not going to talk about that in the context, and I agree with that, but in terms of that, I think there's going to be a huge change in the medical device world, but I don't think it's in the context of like artificial general intelligence or this idea that like, it's going to be like some kind of a silver bullet for everything that we have going on, right? I think it's actually more of, because AI has become much more mainstream, there has been a lot more accessibility to even more traditional, call it machine learning kind of techniques as opposed to like true artificial intelligence kind of a thing, that has allowed basically for new connections to be made that I don't think were top of mind or at least accessible for people to be able to access before. Right?
Yeah.
We're seeing breakthroughs and evolutions in just understanding and better like seeing the data that we have in front of us to connect dots that we didn't think were possible before.
Yep.
I just came back like earlier this week, for example, from New York. I was talking to this company that is focused on using retinal scans to be able to better diagnose diabetes and cardiovascular disease earlier on in the process, right? And predict things like, the risks of developing like diabetic retinopathy and that kind of a thing where the only way these things are possible from what this person was telling me, for example, right, is because the amount of code and knowledge you need to be able to like try out these solutions is so low now, right? That you can create all these different connections with the data and you can have a lot more software as a medical device that will empower platforms that already exist today. And I think that's 100% for the better because it improves efficiency and improves patient outcomes in every way.
100%. Yeah, I completely agree. And one last quick question to wrap it up before we open up to the audience. If you could start a new medical device company today and it couldn't have anything to do with MCG or Genetesis, what would it be?
It's an interesting question. I feel like for me, I would want to stay in the world of diagnostics because I like this idea of being able to affect care at the outset so that people who don't need treatment, because it's a big problem right now, right? People who get unnecessary treatment or people who are missed in the process right now. I really believe there's so much value in improving the efficacy of our diagnostic techniques that I'd probably stay involved in that kind of a space. One thing that I came across recently that I think is interesting, right, that may be an area to explore, still lives in the world of electrophysiology, but more in the neurology side of it, right? Because the brain is also driven by electrical impulses. And a little more complicated there than the heart, to be honest, but there exists, like I mentioned with that, with the ML thing, right? Entire databases of information that talk about things like how well an individual will respond to psychiatric treatment based on what their EEG, their electroencephalograph looks like.
Yeah.
And the same thing with magnetoencephalography, which is a sister technology to what we're doing, for example, right? Where, children, for example, are prescribed medication for ADHD when the reality of it is that their neurophysiology doesn't always indicate it,
Yep.
right? So when we bypass more fundamental like techniques like that, right?
Mhm.
I would say that a technology or a company like that is something I would consider starting next, something where we can better drive like the right types of treatment
Mhm.
from understanding the data of how people's specific phenotypes look like, right, from a physiological perspective, and use that basically as a way to change the paradigm and change sort of the workflow for how we diagnose disease and then prescribe treatment as a result of that.
Awesome. I love it. Thank you very much for answering all my questions.
Yeah,
I appreciate it.
absolutely.
I'm going to open up to the audience. So anyone who has any questions they want to ask me, just raise your hand.
Yeah.
Jarvis, always
Oh.
first.
So,
Introduce yourself because you came in.
oh,
late,
yes, I'm Jarvis, undergraduate case, student, majoring in electrical engineering and BME. And, my question is talking about the changes with the reimbursement and insurance environment within diagnostics and how you think it's gonna affect the entire diagnostic like arena.
Yeah, it's a good question. So at least from the private payer side, they are still very information driven. So if you have outcomes data that is showing, for example, that your technology is a better solution, it'll get you to an answer faster, has better outcomes data, for example. I don't think we're gonna see that world change very much, with the one exception, maybe on the hospital end of things, as reimbursement might be harder to get for some of these newer technologies, right? Because there might be a larger bar or barrier to entry, unless they are proven to be more efficient, because I think then that ties into the other side of things, which is the public payers, right? So things like Medicare, Medicaid, and that kind of a thing. So when we think about like the current stance on rolling those things back, right? I learned recently, for example, that at least in Cincinnati, as much as like 70% of the volume of like procedures done are on Medicare and Medicaid patients. So a huge percentage of it, right? So with that, I think that reimbursement model is also going to be changing, but I think it's going to be changing to favor technologies that are less additive and more replacement or efficiency driven. So I'll use mine as just one example, right? Where our technology basically provides a 5-minute scan to be able to diagnose types of conditions. It doesn't involve any kind of active stress to the patient, no, radiation, there's no physician involvement. So in that kind of world, you open up a new paradigm where you're now removing complexity from the system that those types of payers will favor, right? It doesn't change the fact that you still need to be able to have some degree of like outcome data to be able to prove that, because they're never going to pay for anything they don't know works or they feel like works. But that's my, I guess, short answer to the question. Is I think we're going to be shifting more to a world of, I don't mean this in a bad way, but maybe less precision in the sense of like we need to get the exact answer in all the tests to do it, and more towards a world of efficiency-based care and value-based care.
Cool.
Please, yeah.
Quick aside, was the company potentially called Luminate?
Our company?
The one that you met in New York. The retinopathy one with
No, so that company, I didn't actually meet, I heard about it, that they're part of an incubator, I think in the Columbus area, it focuses mainly on optical.
Yeah, I just happen to know.
Yeah. Yeah, so I met the person who runs the incubator, so he was talking about that, so it might be the same.
That's awesome. Yeah. But no, so my question is, so it's funny, I see like even though I'm in wound care, very different space, but there's so many like synergies in how you're talking about kind of the path and one of the things that stood out to me the most is how you're talking about even 10 years later, you're still innovating on this go to market. And really, it's almost like and right, correct me if I'm wrong, it's almost like you're popularizing the use of this really specific use case by also finding not just other like orphan drug cases, but also like for the masses. Like you're kind of almost like, and that's what I've seen is you're using, I mean, I saw Piyush on LinkedIn the other day putting the fact that he went for a run and then he went to get a quick cardio, and so I think there's a really interesting thing there, but you mentioned how you're trying to empower your investigators. So $40 million in, which I'm sure started with very specific small batches at first, and then how do you prioritize that? Like, how do you create, so like, for example, how much of your dilutive dollars do you input into actual R&D versus Like, how do you try to find it mostly from partners like the Cleveland Clinic? Like,
Yeah.
where does that allocation of capital and like your resources as a company,
Yeah.
how does that divide?
Good question. So our directive basically from our investors has always been, you need to own your core intellectual property and everything associated with that. So at least in the short term, we've been funding it with our diluted dollars, meaning the actual engineering of the device, obviously all the IP related to it. And then from a clinical validation point of view, our core sort of gamut of diseases is all around ischemic heart disease. So that core IP we've owned, we've also owned the clinical validation of, meaning that's all sponsored research that we've done at these centers, right? But at some point in time, when your goal is to become a platform like an MRI or CT, you can own that core, and that's what is sort of a competitive barrier or a moat to prevent other people from getting in, because in our heads, that is the most valuable use of the technology. But then, places like the Cleveland Clinic, we're part of the Mayo Clinic, University of Florida, like a bunch of other these like research institutions have a lot of very smart people who work there, right? And a lot of really cool ideas that come out of there that they then have the desire to seek out the grant funding themselves to run things called investigator initiated studies, where then that ends up becoming something where we pass the buck to them. We basically say, we will empower you to have the core data, but we will let you run with it and actually do what you want to with it, right? And that's sort of a strategic decision you have to make depending on what your company is and how much of a moat you kind of have. Because for us, the special sauce is in both the hardware and the software for actually getting that information to them. And we believe that is enough to sort of keep people at bay. So if you have that, then there's enough value in what you've built that you can now enable other people and empower other people to build off what you built.
That's an awesome answer. Yeah, love it. Thank you.
Thank you. Yes, please.
Yeah, when going back to developing like the first prototype, for the information that you didn't know, like what resources do you like seek out to like learn more about it so that you could develop something efficient?
Good question. So for that, at the beginning, the one thing I will say you should take advantage of is the fact that while you're a student here at Case, you have access to pretty much every academic journal on the planet. So use that, right? So we learned a lot from those initial papers to at least try to like really deep dive into like, how does this science work? What are the techniques people have used for signal processing? Because even though this was invented in the 60s, people have been doing research on it for a while. It's just been in a very constrained academic setting, right? So there has been that evolution of technology that still sort of occurred that we could take advantage of. So that was like a big piece of it for us. And the second piece of it was, once you kind of understand, okay, who has been working on this, you can identify who are the lead authors in that paper. Who can I just reach out to, try to understand more about how this thing works, right? And I mentioned this earlier, but don't be afraid to ask dumb questions, right? And you can preface all of this by saying, I'm just interested in learning. That's what we really did, right? And that helped us out a lot, at least in terms of like better getting to a point where we understood the technology well enough to actually then take it and start developing it ourselves.
So I
Do you have any questions on LinkedIn or Zoom or anything?
No, I also accidentally cut out, so I was about to ask again.
Zoom people, show your faces, hear your voices.
I got the second one. Yeah, so just going back to testing in general, like
Yeah.
if you have like a few ideas here and there, but like how did you go out to find those resources that you needed to first develop those ideas, fail, and then find some new materials to like test it out?
Sorry, I just want to make sure I understand your question. So you're saying the basic thing you want to do, you have a couple ways to get to it, and how do you sort of like stratify and pick those things iteratively? Yeah, so for us at least, that was trying to fail fast, right? So we basically had like very rudimentary setups back where when we first started, we were in Columbus, like a makerspace down there basically, where I remember this specifically because we just never done this before, right? But we like got the magnetic shield that we're using in our device now, right? It's like an initial prototype, and it was literally just sitting on the ground. We had like a wooden platform bed basically we had made. We had a couple things that we tried like very rudimentary with like lab grade power supplies and this kind of a thing. The real thing for us was just like making sure you had the resources to be able to try those things. And then once you're at the point where you can actually like test some of those things and you ran into problems, like I remember one very specific example is that because we deal in very low field magnetics, there are things that you would not expect to cause issues that overpower the heart signal that do. We started off, for example, with an aluminum platform bed, right? Where we learned that just the Johnson noise in the actual electrons in the metal were enough to cause issues. So then you have these like very niche problems running into, you say, okay, this isn't working, but can we understand why it's not working? So then for us, for example, right, we knew that people we had worked with to build the shield had physicists on staff. We asked these questions very naively, let them know our full information about our setup, and they're incentivized to help you because for them, it's about making money on the later sales. You know what I mean? So I think it's about finding areas where those incentives align so that you can test things quickly, but then also have like known knowledge sources that you can use to ask questions when things don't work the way you expect them to.
So, oh, sorry, it'll be a quick one. So starting a company is a very difficult task, especially in the space that you're in and with the regulatory pathway that so I'm willing to bet that you've gotten several options to leave Ohio. Why did you stay? I'm curious, like what has Ohio given you as support?
Ohio has an interesting, I think, mix of things. There's the element that there's a lot of like third frontier funding out there, right? So like our initial seed round of funding, for example, came partially from like Ohio sources, right? So Cincy Tech, for example, we've had continual investments in our rounds from places like Jobs Ohio as well, right? Where they've been very steadfast partners in helping us identify, the additional venture capital partners in the area that also come into rounds. We've raised money outside of Ohio too, but I think especially with COVID and a bit of that like B2B software bubble collapsing a little bit, people became a little bit less worried about where you were located. So for us, then the main reasons and drivers to stay were that it's much cheaper to do business here than it is in a lot of other places, right? So even things as simple as like rent and that kind of a thing to hiring staff and whatnot, right? Like you get simultaneously like assistance from other people. So we don't pay much in rent, for example, partially because like we have assistance and help from like local municipal governments and that kind of a thing that are incentivized to keep us there, right? So as opposed to paying whatever it is, like $80 a square foot in San Francisco or Boston, right? We can get away by paying way less, $17, $18 a square foot. Bringing people and bringing talent on here is also, I would argue, not as scary as people would also make the argument of, right? Maybe back in the day, you had software developers that were only available in specific tech markets, for example. But number one, if you're competent enough to be able to have like a more hybrid or like remote workforce, you can certainly like get by with that. But the other thing too is like there are a lot of good companies here that do med device that have software influences, especially in like the Columbus area and actually Cincinnati and Cleveland both have great medical device markets as well, right? Where you can bring people in who have experience. The thing I would just say from a talent perspective, I know I'm digressing a little bit, right, is just to make sure that those individuals know how to work at small companies, because there are so many big companies where you do one thing day in and day out, but you have to wear so many hats when you're starting your own company that you need people who are generalists over specialists for sure. And I think you can for sure find that here, is I guess what we'll say. So there's sort of been no real good reason to leave because we've been able to have everything we need here.
We have one on Zoom. It's one of our team members, actually. She's asking if you're looking for interns, and the Veale Institute is happy to make connections.
We have 2 job openings right now. One is for a clinical research intern, and one's for a social media intern. So, I don't know if that's everybody's cup of tea here, but those are 2 things we're kind of looking for right now. So
A lot of case grads at your company too, right?
they're actually are.
Representative.
We've hired co-ops in the past from Case several times. We've had at one time up to 3 or 4 people on the team of 30, right, that have been Case grads. So yeah. Whoever, yeah. You want to start? Yeah.
Yeah, so I'm kind of curious because obviously it's a diagnostic device when you're navigating the regulatory landscape of exactly being very specific with what you're stating and what you're giving versus, what is something that's physician determined, things like
Right,
that. Where exactly have you positioned yourself? Because you're trying to be more of a boutique type level where someone can go in and it doesn't have to be a physician, but
Yeah.
where do you control that when you're going through this regulatory pathway?
So our broad mission, right, is to eliminate preventable heart disease. But for us, what we've kind of realized is it's about like the access pathways, and how you get there are very different. So if you think about this like disease in general as a spectrum, right, you have like the earliest signs of disease that are reversible, very early on in the process versus you're symptomatic and there's a reason for you to see a doctor. There are 2 different reasons you'd access this. And that really it's like the one core device has 2 different flavors of product you can use. One of which is this like membership consumer driven product where the information you're getting are more general biomarkers, right? Versus for the purposes of like a physician directed test where you're getting prescribed from a physician, it is a very specific different kind of biomarkers that's specifically looking at had the ischemic disease progressed to the point enough where this would benefit from treatment, is the idea. So you're getting a more general sense depending on which way you're entering sort of that pipeline. But then even the information you get to physicians are, these are the high level biomarkers, this is what the electrical activation circuit looks like. And then it's up to them to say, okay, based on this plus the patient's presentation, this is what I believe the problem to be. It's meant to be more of a decision guidance tool for a physician, but one that can give you a binary high likelihood of having ischemia versus not kind of a tool.
Okay.
Like most medical diagnostics, actually, yeah. Does that answer your question? I hope.
Yeah, no, I think that.
So my question is kind of weird, but like, I go to a lot of cities all the time. And then I do realize when you are having networking events or any kind of setting like that, there's a very different culture in different cities. How you gonna describe how Ohio like in your perception of it?
I cannot speak for like the types of networking events that are meant for more like fully consumer businesses, right? Like, let's say like consumer software, like B2B software, that kind of a thing. I haven't been to a lot of those events in Ohio specifically, but at least the med tech world, I think that is something where there's less difference than you think between cities, at least from my experience, right? So like you have the same types of people who are like interested in understanding how do you recruit talent, for example, how, what are your approaches for things like regulatory, what does your company do, what are the connections you can make, kind of a thing that I found pretty similar. The main difference maybe that I would say is, let's say like a West Coast kind of a thing versus like, center of the country versus even East Coast kind of a thing, is more based on like, in some ways, it's almost like the showing versus telling piece of it. The ideas are a little bit grander, and the mission is spoken in more like idealistic kind of a way, for example, on some of the coasts, as opposed to what I found here, which is more like, this is the operational parts of my business, the nuts and bolts of it kind of a thing.
Amazing. Cool.
Yeah, you said earlier you had up to 3 or 4 case grads at a time. So I was wondering, kind of based on your experience, I think the case student body can be very niche in a way, and as someone who has like experienced it for 2 years, I guess what would you say are some of our general like strengths and our general weaknesses that we could work on before entering the workforce?
I don't want to cast a broad brush on it. We're all big case alum, I think I probably can make some things, make some comments, right? But something I've noticed is good, right, is that I find that most people who we've hired who come from case have a roll up your sleeves, like I'll figure it out kind of a thing, even if the problem is very like hairy and uncertain, and that really is most problems at a startup company, at a small company. So I think that's really a big strength, right? So the tools you have here, like the makerspace here, ThinkBox, for example, like we specifically look for people who have had experience working in those kinds of environments, because then we know that whether it's through like a team, Baja, for example, the VTOL team, for example, right? Those are things where it's like, we know now you've done the experience, you understand how to deal in a situation where there's not a lot of like guardrails for what you're doing. And I find the case of a lot of talent like that, where people are passionate about engineering or passionate about whatever it is they're studying here, and they find ways to get involved outside of the classroom, which is really a big piece of it. Weaknesses, I think that, and again, hopefully this isn't like a typecast kind of a thing, right? But like, I do think there are some people we've hired who, it's like, the difference is really more in like the ambition and how you sort of present yourself kind of a thing, right? Where like, if you are somebody who is like a little bit more, let's say, shy about taking on new responsibilities and that kind of a thing, not because you don't think you can do it, but because you don't feel comfortable speaking up, those are situations where I think sometimes it's like, it's a little bit more handholding that's required to kind of like get to that point, is all.
And then kind of a follow-up question is, I guess, how would you, based on your experience, like build up the confidence to kind of like be an entrepreneur, as well as like believing in yourself enough through the failures to not really give up throughout the process?
It's a hard question to answer. I feel like for me, it was a lot of, you have to really believe in the mission of what you're doing, because then you're okay falling on your face a little bit, because there's a bigger purpose you're trying to serve. And so for me, at least, I think it was understanding that purpose and our goal of saying that like a lot of heart disease is preventable, so what can we do to prevent it, and at least have more insightful ways to look at it, allowed us to say that every single time we sort of fell on our faces a little bit or had a setback, that it was worth just like gritting our teeth and getting through it, because it was all in the service of patients and the healthier world, right, in the long run. So I think that's really the biggest thing. And the other thing I'll suggest as well is that like, we had to learn how to become comfortable not knowing everything about everything but knowing enough about a broad range of skills to be able to say, look, even if I had this problem, I know enough about this other area that I can bypass it and fix it in a different way, for example. Because good enough is truly good enough in this startup world, right? You can be wrong 50% of the time and it's fine.
Thank you.
Awesome. Well, we're at time here, so I was wondering if anyone has one final question to ask Vineet before we wrap up.
Yeah, I think I'm taking your advice on this, the bad questions, but I think I just gotta say it.
Please go ahead.
Yeah, so basically, for developing like a need, of course, it's like other companies, is there like anything specific you did to see like is everybody doing, but like they're not actually like doing efficiently, or is it like, how'd you find your gap?
Oh, yeah, it's a good question. It's a lot about, I think, about in the early days, just listening. So not saying that I have this really cool idea and I'm gonna try to shoehorn it into this area, right? But instead, we went to a bunch of different hospitals, a lot of like, again, very kind people in our past who would just like show us how they practice medicine today, for example, were important for us to be able to understand. There are just broken parts of the system where, for example, you're going in complaining of chest pain for a heart attack. Why are you there for 36 hours? Okay, well, it's because there's no diagnostic tests able to effectively say you do or do not have disease before then, lets you get into a different pathway, for example. So in the world we've built where there's all of these technologies that exist at every level of that sort of clinical journey, many of them have resulted in such complexity for what we found, for example, that like there are obvious like needs for a big revolution in that kind of a space. So what I would encourage anybody who's looking, like, you're 100% right that you should find the market first before like trying to shoehorn your idea into that market. So find people who let you, who honestly, where all you'd have to say is, I just want to hear you talk about what frustrates you about your job, right? And that's a great way to kind of begin that conversation of understanding where are there opportunities to really innovate.
Perfect, thank you.
I'm getting greedy, can I ask another one?
Short one, make it short.
Cool. That tech field, if you want to develop any product, you need to do customer interviews, but these customer interviews, the target audience of it usually are really difficult to schedule any meeting and appointment with them. I have my own strategy of how to get those people done by sitting in a coffee shop next to the hospital and just wait. So what are your strategies in terms of that?
So for user interviews and that kind of a thing, it maybe kind of depends on what you're actually trying to do in design, right?
Yes.
For us anyway, right, our product is not something where we're saying, you know, we have this change this existing surgical tool and we want to know what your thoughts are on doing this approach as opposed to that approach. Nobody has a good concept for what we're trying to do, where it's like, oh, well, I could imagine hypothetically how to use this in my situation, right? So for us, the user interviews are much more informal, like I kind of mentioned, right? This idea of just trying to understand what their needs are, as opposed to like trying to say, will the solution work for you?
Yeah.
And then once you've done enough to sort of engineer the solution, if you have the funding for it, there are groups that can help you like facilitate that research, right? They cost money to use, obviously, right? But if you're trying to do this on your own, then you really need to build, I think, the champions at like various hospitals and that kind of a thing who know what you're trying to do and are willing to give you, you know, a few hours a month or whatever to do that. So, you know, I think the best thing advice I can give that situation is build a relationship as opposed to doing something else, you know, and then like just, you know, like hoping that you will find people who are there.
Cool.
Yeah.
Awesome. Well, thank you very much, Vineet,
Yeah.
for answering all the questions
Thanks
and
for having
for,
me.
you know, delivering such great knowledge to everyone.
Yeah.
Thank you, everyone who attended in person and on Zoom. Real quick, you can find Vineet on LinkedIn at Vineet Erasala and Genetesis on LinkedIn and on genetesis.com. So thank you again, Vineet, and I look forward to watching Genetesis' continued progress and growth.
Thank you so much.
All right, thank you.